Hello, everyone, and welcome once again to another edition of Our Health, Our Community. It's a partnership program with Sullivan County Community Hospital and WNDI. I'm John Montgomery. Today, we've got Dr. Nosa Obayasu right here from Sullivan County Community Hospital, and we're going to talk about the heart. Now, doctor, we see red ribbons everywhere during this month, but for those of us right here in Sullivan County, this isn't just a national holiday. It hits pretty close to home, doesn't it?
Yes, it does because the heart happens to be a very vital organ in the body. And being a vital organ, it's something that I think we need to protect very, very seriously. And based on the numbers we're getting from Sullivan County, we tend to be ranking very high in terms of the mortality rate from heart disease. I think the month of February is going to be a good month for us to try to create more awareness and encourage our community to take very good care of their heart.
Why do you think that the rate is so much higher in Sullivan County than around the state? What do you think? Why do you think that is?
Just based on my experience with patients, I think it's all about awareness. I do not think that there's lack of access to care. I just feel that patients are not very much aware about how delicate heart disease might be. And based on the numbers that we have here in Sullivan, we're looking at about a 47% higher rate than the state average.
Okay.
And I think if people living in this community can increase their awareness, change their lifestyle, I think we have every possibility of bringing that number down.
Okay, that's awesome. But you know, here in Sullivan and Sullivan County, I know the short time you've been with us, we're a pretty stubborn bunch of people, so we don't change our habits very, very easily. We tend to wait until, for example, the tractor breaks down completely before we even take it to the shop. But with the heart, you really can't afford to wait for a breakdown. So what are those quiet signs that our listeners should be looking for while they're out working or sitting on the porch?
I think the first thing we need to look out for is our blood pressure. Blood pressure happens to be one of the silent killers that most people don't pay attention to. And the reason why it's something that is very dangerous because it's silent is because most people can live with very elevated blood pressure until we have a major cardiovascular event. It could be something like a stroke, something like a heart attack, and it slowly grows on us because it is a symptom that does not give us a warning sign. Another thing I think we need to pay attention to is our cholesterol. Our cholesterol is most people who are obese and most people who live a sedentary lifestyle and most people that have a family history of heart disease tend to have high cholesterol. And cholesterol builds in the walls of your blood vessels of your heart for many years. And the first time you may have any kind of symptom of chest pain, the level of cholesterol that has lined your blood vessels might have been something that is very, very, very high. So those are things I think we need to put more attention to: blood pressure, cholesterol. And one more thing I want to mention is blood sugar. Elevated blood sugar can also cause the same amount of damage that cholesterol causes to the lining of the blood vessels of our heart. So if we can reduce blood glucose in terms of the amount of carbohydrates we take, make sure our cholesterol in our diet is low, and make sure we take care of our blood pressure, those three things can really help us improve our overall heart health.
Very good. We're visiting here with Dr. Nosa Obayasu, and he's from Sullivan County Community Hospital. This is Our Health, Our Community here on WNDI in partnership with Sullivan County Community Hospital. You know, when you talk about cholesterol and those types of things, obviously habits that we have come to play in that. People's eating habits, people probably who smoke that shouldn't smoke or vape or whatever it might be, those have to be leading factors.
They are, and I think the main thing I try to tell patients it's just a learned behavior we have to change. So some of the things you've talked about, the smoking, the excessive carbohydrate, it creates a certain level of reward system of addiction in the way we live our lives. And the more we can emphasize to our patients that if we can unlearn those behaviors that we're used to, then we can begin to see very good outcomes in terms of how healthy our heart is going to be.
Well, it's not all gloom and doom, though, Doctor, because I know the fine folks here at Sullivan County Community Hospital have been busy. I've heard talk about the cardiopulmonary rehab and new clinics. If someone listens to this program today and says, I need to get checked out, what has the hospital put in place to make that easier for them?
Yeah, the first thing I want to mention is that we do have a cardiopulmonary rehab in Sullivan County Community Hospital. The rehab is more like a rehab clinic that helps to rehabilitate patients who have had any kind of major cardiovascular event like a heart attack, something like a heart surgery. And that's one thing the Sullivan County Community Hospital has also done. We've also created new clinics, and we expanded our clinic recently, hired new providers. And so we are creating more access for patients to be able to come in and have themselves tested, have themselves go through blood tests for cholesterol, have them come and have do what we call an annual physical examination. So the expansion of these clinics and the providers we have in Sullivan County Community Hospital clinics has actually helped in creating more access to healthcare for patients down here in Sullivan.
Very good, Doctor. For people who are listening to this program right now, what is the heart-to-heart piece of advice you can give our listeners today that want to improve their chances to live a longer life?
I would say that two things I want them to pay attention to. One is longevity, and the other thing is the quality of life. If you are motivated to live long, I think the onus lies on you now to start making those changes. Changes, we're talking about diet, we're talking about exercise, we're talking about making sure you see your doctor, we're talking about making sure you screen regularly. Those are the kind of things I think I want to be able to tell patients, increase awareness, and make sure they have better outcomes. The other thing is the quality of life. Mm-hmm. What kind of quality of life do you want to live when you get older? Mm-hmm. And statistics show that patients that actually exercise, older people that exercise and take care of their heart have better outcomes, quality of life. If I'm going to live to 80 years old, 90 years old, I don't want to be bedridden. I don't want to be confined to a bed. Mm-hmm. I want to be able to walk around and enjoy my life well into the later part of my years. So if that is enough to motivate our community here to take their heart health very serious, that will be a very good move.
Folks, we have been listening to Dr. Nosa Oviaso, I should say, from Sullivan County Community Hospital. He's been our guest today on our program, Our Health, Our Community, put on by Sullivan County Community Hospital and also WNDI. We thank you so much for your time, Doctor, and we thank you for the great straight talk that you gave us today, and we look forward to visiting with you soon.
Thank you very much. I will be looking forward to patients who will come and see me so we can continue to talk about taking care of your heart.
Folks, don't wait to be assigned. Be your own advocate. Check out scch.health or give them a call. Let's keep those Sullivan County hearts beating strong. This has been, again, another edition of Our Health, Our Community from Sullivan County Community Hospital and WNDI. Until next time, I'm John Montgomery.